What is breast cancer? Most kinds of cancer are named after the part of the body where the cancer first starts. Breast cancer begins in the breast tissue. Inside the breast are glands that produce and release milk after a woman has a baby. The glands that make the milk are called lobules, and the tubes that connect them to the nipple are called ducts. The breast itself is made up of lobules, ducts, and fatty connective tissue. Lymph is a clear fluid that contains immune system cells and tissue waste products. The fluid is carried in lymph vessels that lead to small, pea-sized collections of tissue called lymph nodes. Most lymphatic vessels of the breast lead to lymph nodes under the arm. They are called axillary nodes. Breast cancer arises from cells lining the milk ducts and slowly grows into a lump. However, most breast lumps are not cancer. The incidence of breast cancer is rising in every country of the world, especially in developing countries such as India. This is because more and more women in India are beginning to work outside their homes, which allows the various risk factors of breast cancer to come into play. These include In addition, the first occurrence of menstruation at an early age and late age at menopause add to the risk to some extent. Family history of breast cancer increases the risk. If a woman has a mother, a sister, or both diagnosed with breast cancer under the age of 40, her risk of getting breast cancer increases. About 5% of breast cancers are hereditary, that is, due to a gene being transmitted either from the father or from the mother. Typically, these families have many members who fall victim to the disease, which tends to occur at a relatively young age. Let's stop here and discuss. Changes that you must be aware of. A change in the size or shape of the breast. It may be that one breast has become noticeably larger or noticeably smaller. A change in the way the skin of the breast, areola, or nipple looks or feels. For example, painless lump or thickening or swelling in the breast that feels different from the rest of the breast tissue. Swollen, red. Nipple pain. Spontaneous bloody discharge. A nipple has become inverted, pulled in, or changed its position or shape. A rash on or around the nipples. A swelling under the armpit or around collarbone, where the lymph nodes are. Constant pain in one part of the breast or in the armpit. Breast skin dimpling. Many of these breast symptoms are due to benign breast conditions, but only a doctor can really give you a diagnosis. You should report any changes to the doctor without any delay. Over 75% of women who are diagnosed with breast cancer are aged 40 or older. Approximately 97% of women diagnosed with breast cancer at an early stage survive 10 years or more. More than 90% of women who get breast cancer do not have a sister or mother who had breast cancer. Although breast cancer incidence and mortality rates are highest in older women, incidence of breast cancer is rising in younger women. Men can get breast cancer, although this is very rare. For every man who is diagnosed, over 100 women are found to have breast cancer. There is no single cause for breast cancer. Research has shown that several different factors increase the risk of breast cancer. Let's stop here and discuss. Clinical breast examination, CBE, is an examination of the patient's breast by a health professional. For this examination, the woman undresses from the waist up. The health professional will first inspect the breast for changes in size or shape. Then, using the fingers, the examiner will gently palpate, feel the breast. Special attention is given to the shape and texture of the breast, location of any lumps, and whether such lumps are attached to the skin or to deeper tissues. The area under both arms and above and below the collarbones is also examined. Lumps in the breast in premenopausal women may sometimes be caused by cysts containing fluid. This can be aspirated with a needle, which usually cures the condition. Younger women sometimes have solid, non-cancerous lumps called fibroadenoma. Discharge from the nipple is not uncommon, but if it is bloody, this may sometimes indicate the presence of early cancer. Do not ignore a lump in the breast. See a doctor. Let's stop here and discuss. The tests used for screening and diagnosis include mammogram, ultrasound, biopsy, MRI, and more. Mammography is the most common method to detect breast cancer. It refers to X-ray of the breast. Things to expect during a mammogram. The procedure requires that the patient undress above the waist. A technologist will be present to position the breast for the mammogram. The procedure takes about a few minutes. The actual compression only lasts a few seconds. The patient may feel some discomfort when the breasts are compressed, but should not feel pain. To help lessen discomfort, advise patients not to have a mammogram just before or during the menstrual period. If the patient experiences pain during the mammogram, inform the doctor. Women aged 40 or over should be advised to take a mammogram annually. Early diagnosis is the key to surviving breast cancer. Let's stop here and discuss. Treatment options include surgery, chemotherapy, radiation, and hormone therapy. Surgery is the oldest form of treatment for cancer. Surgery offers the greatest chance for cure for many types of cancer. Chemotherapy is the use of medicines, drugs to treat cancer. Systemic chemotherapy uses anti-cancer drugs that are usually given into a vein or by mouth. These drugs enter the bloodstream and reach all areas of the body, making this treatment potentially useful for cancer that has spread. Radiation therapy uses high-energy particles or waves, such as X-rays or gamma rays, to destroy or damage cancer cells and may be recommended for the treatment of some types of breast cancer. Hormone therapy is treatment with hormones, drugs that interfere with hormone production or hormone action, or surgical removal of hormone-producing glands to kill cancer cells or slow their growth. This may be recommended for the treatment of some types of breast cancer. Let's stop here and discuss the multidisciplinary approach, that is, a surgeon, medical oncologist, radiation oncologist, counselors and plastic surgeon from the stage of diagnosis, treatment planning and actual treatment is the key to success. Ensure early screening and treatment. Prepare the patient to be positive. At no point of time, the patient should be allowed to feel dejected or lose heart.
రొమ్ము క్యాన్సర్ అనేది ప్రమాదకరమైన వ్యాధి కాదు. ఇది వచ్చిన వారు ఎప్పుడూ అధైర్యంగా ఉండొద్దు, నమ్మకంతోనే ఉండాలి. ఈ సమాచారాన్ని తెలియజేయడానికి మాతో పూర్తి స్థాయిలో సహకరించండి.
It is important to garner family support to instill confidence and the ability in the patient to fight the disease. Each breast cancer case differs from the other. Avoid comparing notes with others.
రొమ్ము క్యాన్సర్ అనేది ఒకరితో ఒకరు పోల్చుకోకూడదు. రకరకాలుగా రావచ్చు. వాళ్ళకి వచ్చింది, వాళ్ళకి ఇలా అయ్యింది, నాకు కూడా వెళ్ళినా కానీ తగ్గలేదు అనే ఆలోచన మనలో పెట్టుకోకూడదు. ఆ వైద్యం అనేది నమ్మకంతో పూర్తిగా చేయించుకున్నట్లయితేనే మనకు అది తగ్గడానికి కూడా అవకాశం ఉంటుంది.
Extend total support to the patient during chemotherapy. Avoid any negative influence on the patient at all times. Cancer care involves total care from the time of diagnosis through treatment and follow-up. The C word may signify cancer for thousands of patients, but it also symbolizes care, cure and compassion. Please join us by taking the pledge that breast cancer is curable.